Hi, everyone, and welcome back to another episode of Mom Strength. I'm your host, Surabhi Veitch, and I'm really excited to have on Nidhi Sharma today. So Nidhi and I connected on social media, on Instagram, like everyone connects these days. It's like the online dating, online friendships of the future, right? And so she's a PT physical therapist of 15 years. She's board certified women's health and orthopedic specialist. She's passionate about pelvic health because she needed pelvic PT herself, and that changed her life. She's also a mom to a 2-year-old son. Our sons are basically the same age. They're like a month apart, pandemic babies. And I not only love her content and like her content's top notch, like the education, so much detail, so much passion behind it, but also she's real. Like she's a real human being where you feel like she's not judging you if you have these symptoms or, she really just gets it. And I feel like that is rare in the medical healthcare professions these days. She lives in New York, and I'm so excited to have her on. Hi, Nidhi. Welcome.
Hi, Surabhi. Thank you so much for having me here. So excited to talk to you. I love your account. I am like addicted to your stories. I go every morning and it's like, what did Surabhi do today? And so, and I know that takes a lot of work, that take a lot of effort to write all that and put it out there. And I really appreciate you connecting with people because your stories are totally like, they make my day.
Oh my gosh, thank you so much. That means a lot. And you sometimes you know this from being on social media. It's very one-sided sometimes because
Yeah.
you're the one putting things out. And I'm like, this is what it must feel like for people who make movies. Because they're like, this movie's awesome. I'm going to put it out. And you're like, I don't know what people are doing. Are they watching it? And so it's the same thing, right? You're putting it out and you're like, I hope the people who need to hear this hear it and, that you connect with. And I don't know how long have you been on social media?
2000, I want to say 16 or 17, maybe. So
Okay.
it's a bit, I wasn't so active. Like when I gave birth and for the year after, I was like,
Yes.
oh, I'm going to just never work again. This is never going to work out. I'm going to just like sit here in my bed all my life. But then I sort of emerged from there at 1 year postpartum. So I have like a 1 year gap in
Gap.
social.
Yeah. Yeah. Nice. So tell me about your journey into pelvic PT. So what made you passionate to become a physiotherapist and work in pelvic health?
So I had a tailbone fracture. Well, I fell on my tailbone when I was in India in 2000, I think it was six. And then at that time, I had tailbone pain, and I went to like a million doctors. I couldn't sit for like a year. It was awful.
Wow.
And then, nothing. You can't do anything. And then eventually sort of developed into pelvic pain. It sort of started having very severe menstrual cramps. Uh, like it sort of started to spread out from tailbone. And in the process there, within that year, I moved to US.
This was what
I,
year?
and this is 2007.
Okay.
I moved to Texas for my master's. I did my master's and then I went to practice PT. And like for 3, 4 years, I was in pain, more or less. Like, some months were better and then it would come back. And eventually, tailbone pain kind of became like a menstrual pelvic sort of pain.
Yeah.
And I found pelvic PT from a course. Somebody was mentioning tailbone is connected to pelvic floor. I was like, what? How did I not know this? How did I not know that happened? That is there. Like we our PT school
Well,
like stopped at sacrum.
I
Like,
was
okay,
gonna say, this is what for those of you listening who go to see an orthopedic physio, because I still am an orthopedic physio, but
I was
for
too.
people who, this is what we learn. We just learned that the tailbone, if you fracture it, there's nothing you can do about it anyway. So you just have to let it heal. Like literally, that's all we learn about tailbone
Exactly.
pain and fractures, and that's so bad. Like there's so many people with tailbone pain, like yourself, um, who are just dealing with it until they find pelvic physio.
Exactly. So I was 3 years in as an orthopedic PT, and then eventually somebody mentioned, sometimes like tailbone pain can cause menstrual pain, can cause pelvic pain because pelvic floor is attached. I heard it in a course, and my lights went on. Like, what? How is this possible? So I ended up going to a pelvic floor PT, and like for after I had also fractured my tailbone one more time for you know,
Just for the
for
extra fun. Yeah.
wasn't enough. So in 2011, and then when I finally went to PT, I had so much dysfunction in my pelvic floor from years of tailbone pain and pelvic floor tightness. I was starting to develop urinary incontinence, urge incontinence, overactive bladder. Like it all stemmed from tailbone, but became this whole pelvic, like multiple symptom thing. And I went there twice and I was so much better already that I signed up for a course. I was like, I need to
Wow.
go to a course and find out all about this.
Yeah.
And that's it. That's from there on. I was like, I was also seeing a lot of postpartum patients in my practice. The clinic I worked at just so happened to be in the building with an OBGYN office. So they
Mm,
were sending us pubic symphysis pain, SI joint pain, like orthopedic diagnosis. But we know those orthopedic diagnoses have pelvic floor behind them many
yeah.
times.
Yeah.
So I also wanted to help those patients. So I kind of just kept going. And then here we are.
Nice. And when did you move to New York?
2000, soon after. I graduated from Texas and then I moved to New York to practice.
Nice. Nice. So you've been in pelvic health since. And
Yes.
tell me about your own transition to motherhood through pregnancy as somebody who kind of knows this information beforehand, because I didn't know anything about pelvic floor till my after my first postpartum experience. And I was like, I don't know any of this. I need to learn this because I'm a physio. I was a physio for 7 years as in orthopedics, and I still didn't know anything. And goes to show you how much there is missed when we just
Yeah.
ignore the pelvis and the pelvic floor.
Yep. And like even today, orthopedic physios, OTs, like people don't know. So I knew I had been, my practice had primarily been postpartum. I wasn't really treating pelvic pain, just the population I was having. So I was seeing pregnant women in and out for years before I got pregnant. Honestly made me a little scared to get pregnant because I was like always seeing
The worst
dysfunctions
case scenarios too.
the
Yeah.
day after day. So it helped me. I think I had taken doula courses. I had taken a lot of intrapartum courses, postpartum courses. I had taken everything I could find to prepare. Um, but ultimately pandemic happened. Like we couldn't really get this also. We couldn't really
Yeah.
get the support we needed. We couldn't
Yeah.
really have I couldn't have a midwife. I was a high risk pregnancy. Couldn't really have a doula. Couldn't really have that much choice in which hospital to go to. But I think still, I had a very long labor and a very difficult delivery and a high grade tear. I had a grade 3 tear and an actual internal vaginal tear, which is rare. But even then, even all of those things, I didn't come out of it feeling traumatized. And I think that says a lot because when we're informed and we're planning and we're properly appreciating things that are going right and the things that may go wrong, um, I think we're just in a better place. I didn't think, oh, wish I had known this. I wish I had prepared for it because I did. And it is what it is after in the end. And my outcomes, I think, are better because I was on it. I knew that I would third degree tear. I'm more prone to having painful sex. I'm more prone to having leakage, anal incontinence. So I was on it during my postpartum period, and thankfully, I don't have any long-term symptoms at this point. So as much as I think that to some degree it made me a little bit of a control freak because I wanted to control everything because I knew everything. But like further I progressed into pregnancy, I kind of saw that, things don't really work your way. Like I developed diabetes, I developed other things. There are complications coming along throughout the pregnancy. So it kind of prepared me for the labor that, oh, things
Things
don't
may
really go
not work.
well.
Yeah. And I love that you brought that up. People assume that because you're a physio, everything's perfect for you, right? Oh, you know everything already. And you're like, you can know I always say cardiac surgeons get heart disease too, right? Like you can know all the things, but sometimes this is just what happens during pregnancy or birth. But I love that we assume that if you have this degree tearing, that's going to lead to a traumatic experience. But the experience of trauma is based on how you feel. I have clients with no tears who have a traumatic birth experience because of how they were treated, lack of consent, lack of respect, racialized commentary. Like there's so many ways to experience trauma. And I think that's an important reminder that when you're well educated and prepared going into birth, even if things happen not your way, it hopefully prevents that feeling of birthing being a traumatic experience for you.
Yeah, I think I always say this to my patients, birth injury and birth trauma are not same things. I think I have a post about this too, that, birth trauma, like you said, is a lot about how you feel emotionally in the process, which is it's a very emotional process to go through anyways, during birth and postpartum, while birth injury is a physical thing. As hard as it is, it's physical, and we can sort of make peace with that and work around it if our emotions are in the right place. So I think that's kind of what helped me get through my traumatic birth, could have been traumatic birth during the pandemic.
Yeah. And maybe physically traumatic, but not mentally or emotionally traumatic in
Yeah.
the same way. And during the
Right.
pandemic, and I have to say this, like huge respect to you as a first time mother during the pandemic in New York. We know New York had it like it was very high cases of COVID there. It was my second baby during the pandemic. So for me, it was a lot easier because I kind of knew going into it what to expect out of pregnancy and like
But you
mothering,
also
right?
had a toddler. You also had a
Oh yeah.
baby at home. So
I
it's
did. Yeah. I had
I don't know how
she
people
was
do it again.
24 months, 25, 26 months, I think, when my son was
Yeah.
born almost. And she was at home. I was working virtually. It was like looking back, it was survival mode for like 2 years. It kind of
Yeah.
still is, right? Like in many ways, we're still
Yeah.
working through this. And it is hard. So tell me about your postpartum recovery. And I know you grew up in India, right? So your childhood, your adolescence is in India. I left India when I was 8. I lived in Bahrain till I was 10. I moved to Canada when I was 10. So a lot of my like youth was in Canada. So for me, I feel like I'm like this mixed, where do I belong, right? I kind of feel like I
Yeah.
belong in two places. For you, your youth and your childhood was all in India. When you came to the US, how was that transition for you as a person, as a student, and then as a mother?
Yeah, I was 23 when I came here. It was not easy. Also because, I was 23, so I was expecting that I can manage it. I'm like an adult, I can do things. So I came here with not any support system in place. Not that I could have, but I didn't even try to have. I thought I'll figure it out when I get there. So I landed in Texas when I was 23. I was supposed to start graduate school in 10 days and literally could not understand a single word anyone was saying.
That accent and like
I
what
mean, it's also Texas, right?
Texas, yeah.
Looking back, it's like you should have gone to New York or something with a little, less thicker accent.
Multicultural. Yeah.
Texan accent is something.
Yeah.
So accent was difficult, food was difficult. I was a vegetarian. I still kind of am, but I was really a vegetarian. I didn't know food. I really didn't know anything. So first couple of years were really kind of formative in a new way, like I was 14 again.
Yeah.
And I had to figure out and, be embarrassed and be brave and be depressed and be happy, like, all these
Yeah.
emotions that you go through when you kind of discover your world. And I was discovering my world again. And, as I graduated school and then I came to practice, there was like a completely different feeling. Um, I moved to New York, and at that time, I was like, okay, I'm this person from like India with like kind of an accent. I don't have that much accent anymore, or less accent. I didn't try to like change my accent. I think just over the years talking to people, it has. But I was thinking that I am going to be in the service-based industry, talking to people, and what if they can't understand me?
Mm.
What if I can't understand them? Fortunately, New York is a very multicultural place and a very accepting and a very, I think, fair place, to be honest. So it was easier than I thought it would be. And my accent wasn't as bad as I thought. It just, there was progress from there. And like past 10 years have been pretty stable in New York. When I had my baby, that kind of changed everything in a way that he's American and I am not, or I'm still not. And he has an accent. Like he's starting to speak now, and his
Yeah,
accent is already different than mine. And
I
accents
know.
are not big things, but they're like things that you hear
Yes.
every day. Because sometimes we'll say a word and he'll say that word exactly, exact same word differently.
Yeah.
Um, and that happened when we went to India. Recently went to India for the first time, and there was this like a little gap between his cousins saying things and him saying things, and that kind of brought about all these feelings about that time when I didn't belong anywhere. Like there was a time where I wasn't Indian anymore because like I couldn't go to India and start living in India in
Yeah.
2014. That wasn't going to happen either, but I
Yeah.
wasn't comfortable living alone in Texas and at any point. So
Yeah.
I had to like kind of go through this really tough period of figuring out like, okay, if I'm not Indian and I'm not American, then who am I? And kind of go beyond the nationality and beyond your race and beyond everything to sort of figure out who you
Who
are
you
as a
are.
person
Yeah.
and who you really are. And I think that's something that my son will go through, which kind of gives me a little anxiety. That but at the end it has helped me. I think it has made me a better person. And living in New York, I'm thankful that I'm in New York. I think New York is a very fun place to be at, to be doing these things, and probably a more supportive place than many other places in this country.
Absolutely. And like when you're talking, I just see courage, like every step of the way. Like truly, when I think about myself at 23, like 23-year-olds, they're adults technically, but they're also kids. Like until you're like 25, 26, like you're still in that adolescence phase in many ways. And
Hmm.
there's this myth. I always, whenever I go back to India, they're like, do you like India or Canada better? And they think Canada, US is like this, everything is Hollywood, beautiful, rich, wealthy. Life is going to be so much better there. And I always say, I'm like, it's not. For a lot of immigrants, it's going to be a lot harder for a lot longer. It's better in many ways. There's opportunities in different ways, but it's not this like, oh, you just show up and everything's easy. And I think that's important to note for people who are from here who don't recognize the hard work and the courage it takes for an immigrant moving as an adult, stepping out of your comfort zone, studying in Texas of all places. Like, I'm just amazed with you. Like I think that's huge. And what you're talking about with your son and his accent, I feel that too, because my family's like my kids are biracial, my husband's white. So I feel I've had to reckon with the fact that my kids are not actually Indian. They're mixed, they're biracial. And I keep thinking of them as like little me's. And I'm like, they're not little me's. And they won't ever have that life experience that I had growing up in India. So for them, I really have to intentionally teach them Indian culture, not just by eating the food, but like actually intentionally seeking out experiences, wearing the clothes more often. Like for me, it's this big realization I've had in the past year is that they're not going to learn to be Indian or about Indian culture just because I'm Indian, because the language they're not learning in the same way. Like we'll sign them up for language classes and stuff, but even the accent, like I'm Tamilian, right? So you say Pati for grandma. And my daughter used to say Pati, and then she changed it to Patty. And just like 6 months ago, and I'm like, no, it's Pati. And she's like, Patty. And I'm like, it's different, pa and pa. But even that, just that subtle difference in accent, she's picking up from the kids at daycare. And so
Yeah.
I'm like now really intentional about teaching like the right way, the Indian way to say certain words that are Indian, because otherwise they're going to grow up saying Himalayas and, namaste. And so
Chai
like
tea.
namaste. Yeah, chai tea. And I'm like, no, you have to be the one
Just such,
correcting your friends because you know the right way to do it. And yeah, the identity, they're going to be dealing with their own identity, like
I
reckoning with
know.
who they are. Um,
Exactly. And we can help them, but we
we
really
can.
can't because we're not them.
I was never born
Um
here. Yeah, I'll never
yeah.
understand what it's like to be Canadian in that same way. But because I went through puberty here, like I have less of an accent. I've been here for longer, right?
Yeah.
But it is hard. And I just think that our kids are going to be so proud of us. That's what I'm visualizing is because now as an adult, I can be so proud of my parents for immigrating and because they went through the same thing when they were 40 and 45, right? When they were already settled, they were already well enough in India, they came here for a better life, and they struggled for many, like for over a decade. And
Yeah,
people don't
it's
see
it
that.
gets harder. Yeah, it gets
Yeah.
harder as you because like you leave a more stable
You leave.
place in like in India and you come to a more unstable place here. So
Yeah.
it's
That's such a myth that people think everyone leaves for because they're in a war zone or like a refugee. And I'm like, a lot of people are leaving really good, cushy lives with supports like maids and, help around the home and community to come here without community. So do you have community in New York in terms of family or, what is your community like in New York now?
I don't have any family. We don't, my husband's family and my family, 100% of our family is in India. We both came alone as students here, separately, of course. But our friends have been, thankfully, one of my childhood friends and one of his childhood friends have ended up in New York.
That's awesome.
So yeah, so we're like one of my friends I grew up with from Delhi and one of his friends he grew up with. So they're our family. They're, and our group, like we have a close group of 4 or 5 people who are our family. And at this point, we can call upon them for anything that I would call upon for family. I think what I don't I miss family, of course, but I don't miss support because I have support. What I miss for what I miss is for my child, for
Yeah.
Ishan to have grandparents, like to
Yes.
sometimes go to his grandparents or spend time with his grandparents. He was there. He was so happy. He did not want to come back
Yeah.
from India, and he went there. I was like, he's gonna have some like adjustment time. He had no adjustment time. It was like in 3 hours, he was like, I'm here.
Comfortable. Yeah. And I love that. I love
Um,
that you brought him when he's young, like to let him experience India because we haven't taken the kids yet. And that's something we wanted to go in 2020 and then it didn't work out. And I'm like, 2023, we are going because again, if the kids, I know a lot of Indian people who grew up here, they've never been to India and their ties to Indian culture is less because they just don't go. And they've never experienced the culture there. So I think it's amazing that you took him. And I hope that he gets more time with his grandparents because you're right. It's a different relationship with your grandparents than it is with your parents. And they
yeah,
spoil you with love and, affection in different ways. So
yeah, absolutely, absolutely. And
so
one of the reason we get to go to India is because literally all our family is in India, so we can't. It's a problem, but it's also a solution because then that makes us go to India every
yeah,
year. We
yeah,
would just go because we can't not see them,
yeah.
can't not see anyone ever.
And that's the thing. My parents are here, my brother. So we don't have as much of a drive to go. Like all my cousins and stuff are in India, but I also have family in the US. I also have family. I don't have any other family in Canada, but my immediate family is here. So there's less of an incentive, I guess, or push to go back to India. Tell me how it is in America because I'm in Canada and it is different, the support for mothers. How Tell me about the maternal system in the US and how mat leave and the support for moms works or doesn't work.
It's non-existing. I mean, I think US has been in news enough for this. We are one of the, I don't know, 5 countries or something in the world with no paid maternity leave. We have no system in place whatsoever to help any mother financially, socially, emotionally. Like it's so bad that I cannot imagine that a country as big and as successful as
Wealthy. Yeah.
US is doing this. It's insane. It's just insane. It's beyond me. Um, so we have I, I think 4 weeks of or maybe 6 weeks of maternity leave, but not paid. So you're not required to pay. So if you will look at statistics, 1 in 4 people go back to work in 2 weeks because people can't live without pay for more than 2 weeks, especially when you have a child. What are you going to do? And I don't know, like 20% women go to work after the weekend. I had a patient who
Wow.
went to work. She had a cesarean on Thursday, and the reason she had a cesarean was because she was like, I can schedule it after work day.
Oh my gosh.
And then she had a cesarean Thursday and she went back to work on Monday. I'm not
I mean,
kidding.
that's like the capitalistic productivity society where you're literally worth only when you're like working. You're valuable when you're
Whatever,
working.
yeah, whatever
And
money you make.
whatever money you make. Yeah. And I think it's really unfortunate. And I think actually that is why so many women even struggle postpartum with postpartum healing. Because if you have time to let your pelvic floor and core and everything heal, it will get stronger and it will get better. But when you don't have the time to rest, to not be sitting at a desk all day or standing on your feet all day for some people who are working, it's not going to heal optimally. And then you're dealing with like the consequences of the, all the dysfunctions and the issues down the road. And I think it's so, that needs to be changed. Like there's an urgent need for that to be better. In Canada, we can complain about Canadian things, but that part is better. We have 18 months unpaid. And if you have employment insurance through the government, you can get like a bit of money each week, which is not enough for people who live in the city like me, but for people who live in a smaller town or city, that would be a good, good income. So people who want to move to Canada, welcome. But yeah, it is really hard. And I thank you for bringing that up and sharing that, because people sometimes find it hard to talk openly about motherhood and its challenges that are not directly because of parenting. It's because of the social systems that we live in.
I mean, US is one of the highest postpartum depression rates. We have one of the highest maternal death rates, like not related to the actual delivery, but complications past delivery.
Yeah.
We have the lowest school enrollment rates, like college enrollment rates. So, like, we're not doing our kids any good because if parents are absent, kids
Yes.
are not going to do that well, right? So after all of this said and done, where it's the kids who are suffering. Of course, women are suffering the whole time, but kids are suffering because you have this really strong system in place, really forceful system to get the parents back to work. And like the whole sleep training industry, I'm not dissing sleep training can work for many people, but a lot of people are forced to sleep train.
Yeah.
They don't have an option because they have to go to work.
Yeah.
When I was thinking of going back to work 3 months postpartum, there was no way I could do it if I didn't sleep train. Like I didn't, whether if training works for me, that's cool. But if it doesn't work for me, I still have to do it because I have to go to work.
Yeah.
I ended up not going to work because my husband really makes enough money, and I'm thankful for that. And that also is like only 6 months or 8 months in my life that I have been completely dependent on another human being. Like I
Yeah.
have grown up to be independent, and
Yeah.
it's like we're a happy marriage and everything. But you see that if you leave a woman without pay for 6 months, you are reinforcing the patriarchy that already exists in the society because she will be dependent on that person for
Yeah.
all of that time.
Yeah. I
So
felt that too. And it's weird when you're like, I'm financially independent. And then suddenly you're like, I'm at home. And that work of mothering there's no money that can like equate how much work that is. But at
yeah,
the same time, when mothers are not even getting any assistance from the government, any assistance financially, it's not right. Like that the whole maternal death rates and depression rates, it makes sense. We're trying to deal with the band-aid solutions of like, oh, we need to deal with the depression. But we also need to deal with the causes of why mothers are burnt out, overworked. And then you're right, the kids end up with the consequences as well. The aftermath of, not having parents as present, parents who are stressed all the time, working all the time. And, ultimately I feel like they just want uneducated society. They want uneducated, unsupported. They want people to just be robot workers.
yeah,
Because if
exactly.
it's a smart, educated community, they're going to be speaking out against this stuff.
They're really
And
speaking out against the capitalism where wealth is getting more and more concentrated.
exactly.
So
I know.
yeah.
Thank you for sharing that and for speaking out against that. Because I've seen articles that you've written even about motherhood. And I think it's so evident that you're passionate about this and you can bring a perspective that is different because it is different in India. How is it in India? Do you know what the maternal like mat leave? Is it state dependent? How is it there?
Yeah, it's amazing. I think it's 1 year of paid and 2 years of partially paid. It's insane.
Wow.
I think 1 year completely paid and another year partially paid, which you can use. We don't have to use in first 2 years. You can use in first 5 years. So like you can,
Okay.
if
What?
your
That's
child,
amazing.
yeah. So if the child is having a hard time, you can like take 3 months when they're 2 years old instead
Right.
of, you know,
All of the
in the
first two
beginning. It's
years.
first 5 years, and which makes a lot of sense. First 5 years are formative before they go back, before they enter school, and then things a little bit stable. And I see this like, oh my God, it makes so much sense because for first 3 years they're sick. They're so sick
You're
all the
sick all the
time.
time. Yeah. First,
So
yeah, first 3 years for sure. Cause my daughter's now 4.5. She gets sick way less. And if she gets sick, it's like a day. Whereas like my son, he's like got permanent runny nose. I'm like, this kid like constantly just gets the next thing, just as he's getting better, gets exposed again. And people often say the first few weeks are the hardest postpartum. And in many ways, yes, because you're healing. But I actually think it's like when they're older is also hard. Like,
very
it's just
hard.
hard in a different way. And the support for new mothers, it's like it stops at 6 weeks or like stops at 3 months. Like mothers need support all the way through, and
At
especially
least two
those
years postpartum. Yeah.
at least those first couple of years. Exactly. Tell me about I wanted to ask you a question. Tell me about that article that you wrote about motherhood, because I think you share some really powerful insights about motherhood. How has motherhood changed you?
I think it has given me a lot of perspective um, in terms of, um, I guess, priorities. Like I was a very almost tunnel visioned person before having a child because I was very, very driven. And I still am very passionate about physical therapy, but I was very driven to, do all the courses and take all the certifications. And I was absent every month for some course somewhere. And since I had the baby, it's kind of like, I think it changed me physically and kind of reminded me that all the things that I learned I can apply, but also realize that they are not enough. There's like this emotional, there's so many things that are underneath the body that will affect the body that you
Yeah.
just really can't learn in courses, and you have to look at person. And I started to look at myself as a person versus a body,
Yeah.
like a physical body that I want to study. And didn't like I recently last week took my first in-person course in like 2.5 years. It was also COVID, so like that
Yeah.
was part of it. But
Which
like,
kind of helped, I think, because it took the pressure off of, I agree. I took all the courses, all the things, and having kids kind of was like, wait a second. I'm not just a person who studies and puts out information and content for other people. I'm also a human being myself. And it's kind of like giving that respect. I was respecting my kid so much, making sure she ate on time, slept, got all love, tender love she needed. And I'm like, I wasn't giving myself that. And it kind of opened my eyes to how we treat ourselves, especially as women. And also, I think as immigrants, we're working hard. We want to prove ourselves. And it's
all the time.
that colonized approach too of like the hustle culture and uh, almost that stem of like needing all the titles, needing all the certifications to prove our worth, right? And I was like, "Oh, wait a second. Like I didn't need to do all that and I still don't need to do all that." So it's been cool to see that you've learned that through that process as well. And yeah, it doesn't mean we're less valuable physios or less passionate in our jobs and in our careers. Because I think sometimes it's seen that way when mothers change post children, they're seen as
Yeah,
less valuable in the workplace, less dedicated in the workplace, and it's seen as a bad thing because obviously it always centers that capitalistic society,
productivity. Yeah,
productivity, right? And so it's nice to not have that, like, and see mothers
absolutely.
actually self appreciate, like appreciate themselves, and value themselves.
Yeah,
Okay.
I,
What kind of work do you do now? Who do you see? Because you mentioned you work with a lot of postpartum folks. Do you still work with a lot of postpartum folks?
I do. Work with a lot of postpartum folks, but I have a decent bit of pelvic pain, vulvar pain, and sort of endometriosis, interstitial cystitis, and all those things in my caseload because I see people uh, in
In person.
person.
And where in New
And
York are you?
Midtown. We
Midtown.
well, we have two clinics. I am slightly north of mid of Manhattan in Westchester. It's like a train ride away. So we have a clinic there. That's where I live. So I try to practice there more in Westchester County, but we have a clinic in Midtown as well. I mean, it's just a train ride away, so it's not a big deal.
Nice.
Um, and yeah, I'm working full time now and like juggling all the things. Sometimes I wish, and I might do this in soon in future to just sort of cut down on hours on sort of do less and practice doing less and
Yeah,
see how how things change when you do less and you end up doing more. I don't know how else to say this. Like
I
you
agree.
when you yeah.
Yeah. I work less hours now. And I still feel like it's busy. It's not like I'm like, oh, I have all this free time, but I have more time for self-care. I think that's what it is. And so that when I pick up the kids, I'm not like, I used to show up so stressed, like all the time, always go, 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 no breaks, nothing. And then I started having an hour in between when I finished with patients and picked up the kiddo. So instead of directly from here to here, I had that gap, just a transition. We give our kids
Yeah,
transition time. We forget to give ourselves transition time.
that is so true. That is so true.
Yeah.
I
So
do that. I give that half hour to before the train, but I'm not gonna get in train right away. I'm gonna just sit there for 15 minutes and not do anything. And
exactly, and unwind. Yeah. And you see men too in your practice, right?
I
Or
do,
people
I
with,
do.
yeah.
I
And I
see
think
men
that's
things.
that's important too, because a lot of people don't realize that men have pelvic floor issues too, and there's help for men too. And so if you're listening to this and you're like, oh, my partner or brother or spouse or somebody else, has pelvic floor symptoms, pain, issues,
Urinary symptoms,
urinary
issues.
urgencies, there is help for that too, in person and virtually too, in spaces. So tell me, I have some final thoughts. I have some questions about yourself. I've talked about you. We've talked about you, but these are like other questions that help us get to know you in a different way. Tell me about a podcast or book that has been life-changing for you.
Oh boy. Okay. A podcast or a book?
Or just really powerful. It doesn't have to be life-changing, but something that's like, I love this book, or, it's been, or podcast. If you listen to podcasts or read books, I should have asked that first.
I do both. I don't do the both nearly as much as I did
I know.
before.
Yeah.
Um, um, I think "Come as You Are" probably is the book that I would say. I also have a book by Kapil Gupta, and I do not remember the name. I'll text you later, so maybe you can put it in show
I'll share it in the
notes.
show notes. Yeah.
There was a chapter about childhood in there, how to raise children, and I was just reading it as when I was not pregnant. I was not a mother, and one of the things they said, um, I'm gonna paraphrase it and not do a good job, but still, they said something like, the only thing you can do to raise your kids well or to help your kids become, good human beings or whatever they're supposed to become is to work on yourself.
Yeah.
Is to,
Agreed.
if you are planning to get pregnant or become a mother or become a father and you're thinking, oh, what should I do? What courses, what program should you sign up for?
Yeah.
Then the program probably is like, look into your mental health and look into your physical health. And because they
Yes.
will become who you are, who you truly are. They will become who you truly are, whether you want it or not. And then they will be a mix of all the people that they're around, so
Surrounded with. Yeah.
that's only thing you can control. Other than that, you cannot teach them anything. And I think that really stuck with me with that's when I wanted, like, okay, I have to work on myself. I have to.
Yeah.
That's the only thing. And I do not remember the name of the book, but I'll tell you which one it
Couple
is.
Gupta. And I
Yeah.
would love to hear that book. And I completely agree with that sentiment. Personally, like, because my daughter is now 4 and I see it, because there's times where I'm trying to get her to go to bed. And she's like, Mama, I know you were up really late. Why were you working so late? And I'm like, here I am trying to enforce these things that are good for her health. And she's calling me out on things that I'm doing that isn't good for my health. But that's because we've talked about it and the importance of this. And I tell her, and I said, you know what? Mommy has practiced this way for a very long time, where she stayed up really late, overworked. And it's a hard habit to change, but I'm working on it. And so she learns that I'm also human. And it's an overwork. It's again, a complete habit that I've learned over years of trying to, again, as an immigrant, trying to prove my worth, trying to prove that I'm good enough. And, as a parent, I'm like, oh, this is work. Therapy is the best thing for me that I've started in the past year and a bit. It's just been eye opening that so many things that we get upset about that our kids do is it's just about ourselves. And,
Absolutely. Yeah.
completely agree with that. What I wish that I did in pregnancy was start therapy and start really looking at my own habits and why I do things a certain way. I used to treat myself like a robot, kind of similar to kind of when you were talking. I kind of really felt that is courses all the time, worked all the time, took an extra job at the hospital. Didn't need to do all that. I was just doing it all and never stopping to breathe or rest. And if you're pregnant or postpartum, just recognize that that's not a sustainable way to be. And please do share that book with me so I can share it in the show notes because I think it's going to
I
be a
will.
powerful one. So, what are 3 things that you do for yourself every day for self care, rituals that you like doing that kind of help you feel taken care of?
Okay, I work out every day. Sometimes that workout just looks like breath work. Sometimes that workout looks like lifting, sometimes yoga, but I do get on my mat. And some days when my baby is sick and I cannot get on my mat, I'll lay next to him and I do something. So I really, really try to be very, very accountable to myself for doing that. And that can look like 3 minutes, it can look like an hour, but it'll
Love
happen.
it.
And the second is I will never skip breakfast. So that's something I used to do a lot. So I really made it a point that not skipping breakfast, even if whatever is happening around me, I will still eat. It's funny that my husband knows that now.
Yeah,
So he's like, some days he knows that I'm going to be busy in the morning, or if I'm sleeping late and he's up, he will make me breakfast because he
that's
knows that
sweet.
I'm gonna lose it if I don't have breakfast. And I sleep more than 8 hours every day, which is a big feat
That's
for me,
amazing.
having lived all my life, like I don't know, from like 10th standard,
Yeah,
living on like 6 hours. And into like in my head, I convinced myself that if I'm feeling okay at 6 hours, then I should be okay. It's only now that I feel like, oh, 8 hours sleep, if I don't get it, then I can tell that I'm going to break out in 2 days, or I'm more likely to get sick, like all those things. So, sleep, exercise, and breakfast, I
breakfast.
think those are things. I want,
Those are all goals for me. The breakfast every morning. I never used to eat breakfast and thought I was okay. And now I'm like trying to be more intentional and sleep. Thank you for speaking on that because I think a lot of people just think that they can handle it. I don't have as many sleep needs. And I said, until you actually give yourself the sleep that your body needs, you don't realize that you're always working subpar. That's why you're always stressed. That's why you're always responding to things a certain way. That's why your nervous system is like clenched all the time. It's like give your body what it needs and it will start to heal.
and especially in motherhood, like if you are finding yourself very triggered by what kids
Everything.
are doing, or like how imperfect, like how everything gets thrown around all the time, right? You're trying to plan something and then that's just not what happens. If you don't, if you sleep, you will see that you will handle it better. Like you just have to see it. There's no way to explain it. You just have to see it. It'll
Yeah.
happen.
Just
So
and
I call that.
for me, that's going to bed earlier because my kids wake up early. So if I don't get my butt to bed earlier, like last night, I was wired after we had the a melanated pelvic floor PT chat. I was kind of wired, I was working later. So I went to bed later. And then luckily I slept in this morning because my husband is amazing and does mornings most of the time because I'm not a morning person. But yeah, I really do find that postpartum sometimes is out of our control. Your baby is going to want to wake through the night to eat, to cuddle. But once you're out of that phase, really trying to honor that sleep. So thank you for that reminder. I will. That's a mental note for myself. Nidhi, tell me something you're passionate about right now.
Um,
Doesn't have to
you
be
know,
work related.
yeah, my passion has always been to ask patients to speak for themselves. And I think my Instagram, my social media, my blog, all the places that I write has been driving towards that, to like, advocate for yourself. And advocating for yourself doesn't just mean that you have to like know all the things or question your doctor, but it also means to prioritize your health. Like how do you I had a conversation yesterday with a patient, and she was like, how long is this going to take? Or how do I like, I don't know if this is working. I was like, it's going to take as long as it's going to take.
Yeah.
Right. And I would never have said that 5 years ago, because like we came to PTs was like, oh, you have to get patient to buy into the program, tell them that you're gonna get better. It's like, I want you to come from a place where you honor your body and you want to understand it. You don't want to just, you don't need
Speed
me to
through it.
fix it.
Yeah. Yeah.
If you're here for me to fix it, then I will fix it, and I will fix it 2 months later again and 2 months later again.
Yeah.
If you really want to fix it, you really want to get to know your body, I want you to let go of that expectation and really try to be curious about what's happening in your body. So
Love it.
some days I bore my patients to death, but like,
But I think they'll probably leave better off, not just for their pelvic floor, but their overall health. Because it does take as long as it takes. It's like fitness. How long will it take me to get back to, I don't know. It'll take as long as it takes. Because it's not just, yeah, research will, I hate how people are like, oh, research says it takes this many weeks, but also you're a human being, not a research subject. And life might sideline you with injury or death in the family or something major. And that is going to impede or impact your recovery as well. And I think just honoring that we are not a perfect timeline, and things just take time. So I love that. And you do advocate for that on your page too, where it's putting the power not back, because the power is always in the patient's hands, but helping them see that they have the power to speak up
yeah.
or to, advocate for themselves. If you could change one thing in the world, what would you change?
US healthcare system. I really would change like maternity system. It's like it's really, I cannot imagine how much longer can we go on like this. This is a crisis, an absolute crisis. You've heard about the abortion care as well. It's like it's
Yeah.
going south so fast
Yeah.
that we need like a U-turn so bad. I think the whole world probably needs US to like get it together.
Well, because they often model, or they use US as a model, and they're copying like the Western approach, and as if it's better all the time, but it's not. And I would change that too. And I think that it affects people of color, Black women, disproportionately in people who are, a lower socioeconomic status. So it doesn't impact everyone in the US the same way. And so some people might be like, what's the problem? It's great here, but it impacts so many other people. Going back to work in 2 weeks? What? Like
Yeah. 1 in 4. It's
one
insane.
in
1 in 4.
four. Wow.
Um,
25%. That's a lot. And that's too much. No woman should feel the need to do that. And unless she wants to, truly, right? Autonomy, but at the same time, that pressure shouldn't be there. Nidhi, tell me what you think is what you feel is your mom's strength.
I think adaptability. I'm really learning, or at least I've gotten good at being adaptable from the 25-year-old who was like controlling everything. Even 35-year-old was controlling everything, to like, I'm 38, and really learning to adapt around things, and more than anything, just sort of find the good, or what's going right instead of what's going wrong. So I
I
think
love
that
it.
is my strength.
I'm like inspired by you. I just see, I'm like, this is what, I've learned so much from you. Thank you so much, Nidhi, for sharing so much of yourself online, on social media, here. If people wanted to connect with you, what's the best place they can reach you at?
So my Instagram handle is pelvis.and beyond. I also have a Facebook page by that name, but I'm very much more active on Instagram. And my email is sharma.nidhi.pt, if you want to put that in show notes,
I'll put that in the
at
show notes.
gmail.com. If they want to reach out, if they're in the area, if they're looking for pelvic floor health, virtually or in person. And sometime next year, I will start some online programs. I'm working on it right now.
Love it.
So we'll talk about that when we get there. But social media is probably the easiest place to follow me at and follow what I'm up to.
Awesome. That's where we connected. So I'll definitely share all of those links. What languages do you speak, by the way?
Hindi and English.
Okay. Somebody just asked me if I spoke one of the many Indian languages, and I'm like, I don't, but maybe I know somebody who does. Um, Hindi is a goal of mine to pre-practice because I only learned till I was in grade 5 and I've forgotten so much. And the only lines that I know now are Bollywood movies. And so I can speak very dramatically, but
I mean, that's where we all learn our Hindi is Bollywood movies.
it's true. Nidhi, thank you so much for sharing your time with us. Lots of love to you. And I'm so excited for my audience and to listen to this. If you like this episode, please tag us on social media and share this with your community and your friends. Thank you so much.
Thank you, Surabhi.